to head into some of the Q&A here. So to start us off, we have some general or maybe one or two general ED questions here, which I think are pretty important, I guess, to cover. So what are some tactics men can use to improve or resolve ED before it becomes a problem? And is ED reversible?
Yeah, so the question was what tactics to preserve erectile function?
Yeah, I guess to help prevent it or prolong it from happening.
Yeah, so erectile dysfunction, what's good for your heart is good for your erections. So I'll keep it very simple. Really what it comes down to is just maintaining a good, healthy quality of life. So sleep well, right? Try to get at least 7 hours of sleep. The reason I say that is because that's good for your testosterone levels. We know that for good blood flow to the penis, you need healthy testosterone levels. Healthy diet, unhealthy diets, you get diabetes, high cholesterol, high blood pressure, all of these things, they calcify the arteries that carry blood flow to the penis. So that decreases the amount of blood that goes to the penis. So healthy diet is quite important. Exercise for the same reason, keeping good vascular blood flow, keeping good blood flow not just to your heart, but you're also your penis again. And then lastly, minimizing stress. The reason why stress is so important is because higher stress levels, so the same precursor hormone that goes to the stress hormone is involved in going to testosterone production. So if you're more stressed out, you have less testosterone levels. So those are the 4 ways of doing it. Obviously, there's tons of supplements. There's different things you can do to boost up your testosterone levels, those kinds of things. The science on them is good for a lot of them, but and I won't even get to that part. But those 4 things, if you could do those, you're going to maintain good, healthy erectile function. And more importantly, you're going to have good, healthy cardiac function and overall health. So that's the way to do that. And the second question was?
The second question was they're wondering if ED was reversible. So I think it's pretty inevitable, and they're wondering if you can reverse it ever.
Yeah, it's a tough one in the sense that I think you could delay the onset of it, right? But we're all going to get erectile dysfunction. Once you get erectile dysfunction, the best thing to do is you want to revert or you want to go back to doing those 4 things in order to delay the progression of it. Everyone, like I said, everyone's going to get it. Sometimes you could blunt the curve so you could get it into your 60s or 70s versus your 40s and 50s. But it's not necessarily, you can't reverse it. You could just decrease the decay, if you will.
Moving right along. So this is the topic of tonight's discussion. When oral ED medications do not work, what makes this injection therapy that we've discussed more effective?
So oral medications, you're taking them and they're being processed by your GI system and your liver, and it has a systemic effect. So it works, in all the blood vessels in your body, but primarily the blood vessels of the penis and the pelvic area. Whereas the injections, they're focused directly in the penis, in the erectile bodies of the penis. So you're getting a concentrated dose directly at the target organ, rather than taking a pill that's going to have a systemic, or it gets diluted in the rest of your blood flow, in the rest of your blood, as well as going to other vessels and parts of your body. So it's just a concentrated dose at the target organ is the reason why injection therapy works so much better.
Let's see, next question here. What are the latest injection therapy meds that have been proven to be effective? I think that would probably be Quadmix, if I'm not mistaken.
Yeah, exactly. So the science is advanced. We first started with one component, prostaglandin, then papaverine. Now we're at Quadmix, where we had atropine. So that's the big Bertha amongst intracavernosal injections currently.
Let's see. Would you say that injection therapy can create a firmer erection than Cialis or Viagra? And would this erection last longer?
Yeah, definitely. If Viagra and Cialis are not working for you, injection therapy is a great option. It's a great option. It's a more reliable option as well. I mean, Cialis, it worked. There's no dietary restrictions associated with it. Viagra, there are. So if you've had drinks, if you had dinner, and you take a Viagra, it's not going to work as well because you have to take it on an empty stomach. So the oral therapies are not as reliable, whereas the injection therapy, there's no mixing it, right? I mean, there's no food, no food. You're directly injecting it into the target organ or the penis. Therefore, it's way more reliable than the oral therapies, and way stronger because of the fact that it's being It's a concentrated dose directly into the penis.
Let's see, next question here. We see this quite a few times. Any idea why injection medications are not covered by insurance companies?
It's a great question.
I do have a MenMD answer, and what we have been told from our patient health support team is that insurance typically doesn't cover intracavernosal injection therapy treatments such as Bimix and the others we've mentioned because they are compounded medications that aren't FDA approved. So unfortunately, there's not much room there for coverage.
Yes.
Alrighty, moving right along to the next question. Do you lose any sexual sensation when erect with the injectable medications?
Absolutely not. If anything, you get stronger erections. You're going to get stronger erections. Well, excuse me, you're going to get more sensation. You get more stronger erections. So you get the penis stretches out even more. As the penis stretches out even more, the nerves for stimuli, for sensation get more stretched out, and therefore they're more sensitized, and everything becomes more pleasurable. So the stronger your erection, the more pleasurable it will be. So therefore, the injection therapy does the opposite. It makes things a lot more sensitive and a lot more pleasurable.
Can't complain about that. And a follow-up to the previous one about insurance, the note I was sharing was from MenMD's perspective. We're a compounding pharmacy, so our medications are not FDA approved, but there are intracavernosal products out there, name brands, that are covered by insurance companies. We just do not carry those at MenMD, so we cannot speak on that. But carrying on here, can penile injections also affect the length of the penis besides the hardness?
Not really. Your penis, it's not going to add any length, right? But one thing I'll tell you is the penis really is one of those things. If you don't use it, you lose it. So if you're not getting strong erections, what happens? If you're not getting regular erections, nocturnal erections, like we all did when we were much younger, what happens is it starts to scar down or shrink in size, whether it's in length or in girth. So the penile injections, what they can do is they could obviously preserve. You're getting good, strong, very strong erections. So therefore, you could maintain length and girth, which typically, as the aging of the male penis is, it shrinks in size as we age.
Next question here. Saw this handful of times as well. How many times is it recommended to inject in a normal week?
So I say no more than every 24 to 48 hours, right? So initially when I started my practice, I would tell guys don't do it more than every other day. I've had a lot of guys who broke that rule, and they would do it every day, which is fine. So I would essentially say don't do it more than every day. So no more than once a day. And obviously 24, I would say 24 hours.
Alrighty. Are there, I guess this is a follow-up to the previous question about the insurance-covered injection meds. So someone's asking about injection pens. That's not something we offer at MenMD, but perhaps you could fill us in on those.
Yeah, or like they're thinking like Ozempic or something like that. No, unfortunately not. There's no auto injector like one size fits all because everything is so custom tailored to the individual. You have to, if you're looking for something like that, you have to preload or you have to load up your own syringe into the auto injector.
This person here says they've tried Trimix but cannot tolerate some of the penile aches they experienced. To their understanding, there may be other formulas that may not give them this adverse reaction to key ingredients.
Yeah, so that's a great question. So prostaglandin is usually the culprit when it comes to penile pain. So the way you could play around with that is, if you look at MenMD website, for example, Trimix, there's different concoctions of Trimix, different combinations. So if you're getting the prostaglandin at 20, you could decrease that to 10 and increase the papaverin. You can increase the phentolamine, whatever it is, but you have to decrease the prostaglandin in order to decrease the pain associated with the Trimix injection. So you have to play around with that combination in order to prevent that penile pain.
Alrighty. So this question a handful of times. There's some people out there that find their normal injection amount works perfectly, and then other times not at all, and they're just having some troubles understanding some basic factors that could be playing into that.
Interesting. I've heard that complaint as well. When I hear that, I think to myself that the injection technique isn't always consistent. It's not always done the same way, because if as long as you're getting the substance into the erectile bodies, it should work the same. Now, are you going to have some variation where you're going to have like a 9 out of 10 erection one day, 7 out of 10 erection the next? Sure, but you're not going to have a 9 out of 10 erection one day and like a 2 out of 10 the next day. Unless you're injecting it into the wrong spot. So I would focus on the injection technique, or at least review the injection technique just to make sure you're consistently doing that each time.
Alrighty, moving along to some dosage questions here. Pretty good question. This person wants to know how to find their effective dosage without risking taking a overly large initial injection. I think that's normally done in the office, but the second part of this, which is probably a great question as well, without spending incremental increased costs. So
it's a good question. So it comes down to the way I like to do it is, and every urologist is a little different, but what I would tell you is it depends on how bad or how severe your erectile dysfunction is. So, for example, if you're taking the oral therapies and you're maxed out on the Viagra's and the Cialis, and your erections are 1 out of 10, 2 out of 10 at best, you're going to need, like, prostaglandin by itself, probably won't do the trick. Bimix by itself probably won't do the trick. Like, you're going to need like a lower dose of a trimix, for example. But if you're a guy who's, you have good response to Viagra, you have a solid response to Cialis, and your erections are 4 out of 10, 5 out of 10, doesn't get any better than that, maybe you could respond to the prostaglandin. So not everyone's going to start off at prostaglandin and then go to Bimix and then trimix. You kind of have to gauge the patient depending on how severe their erectile function is. Some guys could skip a few steps. So it's a stylistic thing amongst your provider, your urologist. But I agree with you. You don't want to be wasting too much money doing that. And it's important to express that to whoever's prescribing that to you.
Great points. I think we kind of talked about this, how over time the same dosage will diminish in effectiveness. So how to increase the dosing if you're finding over time your standard dose is not as effective.
Sorry. So yeah, like I said, I tell guys to increase in increments of 5 or 10 units. If you've been on 40 units and you feel like your erection's at 6 out of 10, it's not what it used to be, and you increase by 10 units and you're like, oh, it's too painful, the erection's way too painful, go down by 5 units. So there's a style. Obviously, there's a style to it too, and as patients, you don't necessarily need your doctor's orders each time to do that, but just remember, you could increase in increments of 5 or 10 units safely. Increasing more than that, you run the risk of priapism. So you could go up by 10, go down by 5, play around with it if you'd like, and you could do that very, very safely.
Alrighty. Another question here, saw a few times. This one probably isn't in the dosage category, more so the general, but is there any age limit to this therapy? We have someone here who is 78, says they're in great physical condition, and they're wondering how much is too much in terms of increasing their dose.
Yeah, so I say don't go more than 100 units, right? So some of these syringes are only 50 or half milliliter. Some of them are 1 milliliter, so 100 units. So, but you don't want to be drawing out 100 units and injecting, and then drawing out more and injecting. At that point, you have to start thinking about either going to quad mix, upping the concentration, upping the ingredients. You want to think about the next step at that point, but no more than 100 units each time is my rule in order to before you. If you go above 100 units, then you have to talk about different chemicals and different treatments.
All right. Moving along to some injection technique questions. Saw this a handful of times here. So if you inject repeatedly in the same location, will you or can you develop scarring?
Yeah, so definitely, and that's something to be aware of. The more you inject, so every time you inject into the corpora, it's a very delicate tissue. Your body responds to that. It takes a little bit of an insult. So over time, you're doing this for 10, 15 years, you could obviously create scarring in that elastic, smooth muscle supposed to be very elastic. So what that can do is it loses that elasticity, therefore you get weaker erections as a result of it. So intracavernosal injections, as they work fantastic, but listen, there's no such thing as a free lunch. So everything has a side effect, and that's the main side effect associated with intracavernosal injections.
Alrighty, I like that one. No such thing as a free lunch. So, next question here: if the injection does not result in what you want, is it possible to re-inject on the other side right after?
No, please don't do that. Please don't do that. Yeah, not right after. The next time you can do it within, after 24 hours, but not immediately.
Alrighty, do not do that. Next question here: with repeated injections for erection, does it help or hinder me from ever achieving a natural erection after prostate removal?
Yeah, it could. Obviously, it depends on the technique, depends on who's doing it, depends on what your erections are before. There's a number of variables that go into that, but we do know a prostatectomy, there's about a 20 to 25% rate of impotence. That could improve after surgery, depending on your regimen, depending on how the surgical technique was done, all those things. But that is a known side effect of a prostatectomy is impotence, postoperative impotence. And there's ways, who can mitigate that. One of them being Viagra, the oral therapies, the other one being intracavernosal injections. But the one thing I would tell you is the earlier you get your erections going post-operatively, we have a lot of science on this. It's incredibly important. So if you're struggling with erections 3, 4, 6 months after surgery, that's a problem. You have to get going because if you don't use it, you lose it. Your penis shrinks in size, length, all of that.
So moving right along to a follow-up question. This person says that their penis is now shorter after a prostatectomy. They're finding it difficult to find an injection site, and they're looking for any suggestions to do so.
It should be the same. I mean, really, you want to look, again, like we talked about earlier, aim for 3 and 9. You could even go like 2 to 4. You could go 8 to 10. You want to aim, but the closer to the base of the penis. If you can't get close to the base of the penis, you can go a little further out. But anywhere on the penis, the prostatectomy shouldn't impact that significantly.
Next question here: is it possible to bend the injection needles during the injection process? And if so, why would this happen if being careful?
It's nearly impossible if you're using a fresh needle, because the needle is so thin and narrow. If you have a dull needle that I'm complicating this. I apologize. The answer is no. It's nearly impossible to do that.
Certainly. Yeah, if that happens, you might need to revisit the injection technique.
Precise. Thank you. Exactly right. You need to revisit the injection technique. Precisely.
So we talked a little bit about auto-injectors helping people with dexterity issues or just getting over the fear of the needle itself. But this person's asking, does using an auto-injector reduce the chance of scarring and possibly Peyronie's?
No, it doesn't. The auto-injector doesn't decrease that risk. You're still penetrating into the same tissue with the same needle tip, so it doesn't change it.
Right. Next question here, very great question we see every event, or every time we run this event rather. This person says it's very difficult to inject themselves because they're a rather large person. Looking for a technique that is safe and works to inject when they can't see the injection site.
Great question. Yeah, this is a common complaint, or common question, I should say. It's one thing I'd say is obviously practice makes perfect. I have a lot of guys who they'll use a mirror. They'll look inside a mirror. They'll figure out. They'll see themselves, but in order to do that, so that's one technique. And to my point, practice makes perfect. The more you do it, the easier it gets when you're looking at the mirror. Or they have a partner who does it for them, whether it's their wife, whoever it is. But they have a partner inject because they can't see it. So it is more common than you think. What you're describing is way more common than we think. So, but there's ways to mitigate that. Those are the two I generally suggest. Look at a mirror and then have your partner do it. Right. I don't know if you could give any, since you've heard the question.
That's what we've heard in the past too, and what we also recommend is a partner laying down on the bed, looking in a mirror, or sitting down on something and looking into a mirror, just somewhere where you can see yourself, I guess, and also be seated and safe. So yeah, next questions, our next set of questions we're moving along here will be about using injection therapy with other therapies and or conditions. So quite a handful of different ones here. The first one is, can injection therapy be used with a VED?
It can't use it at the same time concurrently with a VED. You shouldn't need to. I apologize. You shouldn't need to. So the answer is don't use it together. The strategy would be to increase the volume or the concentration of the injections in order to get a much stronger erection rather than using the two of them in conjunction to get a stronger erection. So don't use them together. Just focus on optimizing the use of your intracavernosal injections.
Alrighty, great advice. Next question here, can injection therapy be used on blood thinners?
Yes. Yeah, not a problem. Just if you notice a little bit of blood or a little bit of bleeding coming out of the injection site, just put pressure on it. 30 seconds, 60 seconds, you can be fine. No problem.
Alrighty, cleared for blood thinners. What about using injection therapy with PDE5 inhibitors such as Viagra or Cialis or others?
Yeah, so this is a common question too. So I say it's not a problem at all because the injections are getting into the injection therapy. It's really getting your erectile bodies. The head of the penis or the glands of the penis has a separate blood supply. So some guys they complain. They're like, "Hey, listen, I'm just not getting enough blood flow to the head." So I tell them just take daily Cialis, low dose daily Cialis, even if it's 5, 10 milligrams a day. It's good for their prostate. A lot of those guys are already on it because of for their prostate issue, for their enlarged prostate, so it helps them urinate. So it's okay, it's safe to do that, not a problem.
Alrighty. We have a next set of questions about injection storage. I think I can read off this fact sheet I have here to answer all of them. Most of these are about the shelf life, freezing, punctured versus not punctured, or if it's safe. The general rule of thumb from MenMD and what we tell all of our patients is after 28 days, we cannot guarantee the effectiveness of the medication any longer. However, that being said, it's not unsafe to use it. It just may not be effective, and we cannot guarantee what we had sold you working. And this differs for different products. So Bimix, the beyond use date is 60 days. Trimix is 30. This is because of the added ingredient alprostadil. Same goes for Quadmix. And the 28-day rule that I just was mentioning was for a punctured vial. So after the first puncture, 28 days after being stored properly, we can guarantee that it will work the way we marketed and sold it to you to. But after that, the medication, as it's compounded, starts to lose some of its effectiveness and will not be as effective. So I think that should cover all of the injection questions there. It's basically a do-at-your-own risk type of thing, but you're not going to be at any adverse risk, I would say. So next group of questions here to wrap up the event will be about ejection side effects. So can you use Sudafed to help with an erection that's lasting longer than 4 hours?
Absolutely, absolutely. So Sudafed is a great option for that. So the earlier you take it, the better. The other thing you could do is urinate. That emptying the bladder helps with getting blood flow back to the body, and then ejaculate. That helps as well. So those are generally the three techniques I tell guys if before God forbid, having to go to the hospital or go to their doctor's office. Do those three things. Excuse me, four things. Put ice. The other thing is put ice on the suprapubic area, right at the top of the penis. Put it around the penis. Put it in the perineal area, the area between between the scrotum and the anus. That helps as well.
Next couple of questions here are a bit similar, but we saw them a few times and they're a little bit different. So first one is it normal to experience swelling and redness at the injection site? And if so, what can be done to prevent this?
You shouldn't have too much swelling. I mean, it can happen once or twice. Yeah, that's fine, but that shouldn't be a common occurrence. Usually, again, that means the injection technique is you're not doing it the right way. You're injecting it. You're injecting the needle into the skin layer. Sometimes the other thing to note is the penis itself has a number of superficial veins along the like underneath the skin, but not in the erectile bodies. Avoid those. That's another reason why you get bruising and swelling. Sometimes, whether we see it or not, we inject it directly into that vein, and that bruising happens. Again, if it happens once or twice, it's nothing to worry about. But if that's happening more times than not, then your injection technique needs to be revised.
This person asks, does injection therapy work independent of sexual arousal?
Excuse me, it does, but not the way it would with sexual arousal. So you need that sexual arousal in order to get things going. Can it give you somewhat of an erection? Can it take you from 2 out of 10 to 4 or 5 out of 10? Sure, but it won't take you the rest of the way. No.
Alrighty. This person here says, what if you go through a vein while injecting and you see blood underneath the skin? Will this vein/blood heal on its own?
Yeah, they just put pressure on it. Like I said, 30 to 60 seconds, put pressure on it. You'll be good to go. Nothing to worry about.
Would a narrower gauge needle reduce scarring and possible chances of developing Peyronie's?
Probably. That's a good question. Yeah, it's a good question. Probably not to a significant, not significantly, because I mean, the diameter of these needles it's microscopic differences. So I would say maybe, but probably not.
We'd like to thank you all for joining tonight, and we'd like to thank Dr. Houman for presenting. If you'd like to learn more about injection therapy, all of these guides for any of our products or treatments are available on the MenMD website, on the resources page. If you'd like to contact MenMD support, this will be how you can have your question answered if it wasn't answered during this event, unfortunately. You can call MenMD at 857-233-5837 or log into the MenMD portal to schedule an appointment with a MenMD personal health assistant. If you're interested in injection accessories or learning more about any of the injection products that we talked about today on tonight's call, you may do so on menmd.com and navigating to the erectile dysfunction condition. Under there, you will see all of the products, so the various formulations of ICI medications where you can actually compare. And if you're interested in any of the injection accessories, so anything from syringes, alcohol swabs, the Insel tote, you can find this on the MenMD shop page. Thank you everyone for attending tonight's webinar, and we hope to see you at the next one.
If you found this video helpful and want to stay in the loop with our growing men's health community, be sure to subscribe to our channel and click the bell to be notified when new content is available. Your support makes it easier for other men like you to find these helpful resources. Thanks again for watching. We hope to see you again.